Okay, I think we've got a pretty good group at this point. I want to welcome everybody. I am the program chair for South Florida HIMSS right here in sunny Miami, Florida. I want to welcome you to our best practice healthcare digital transformation model. And I want to give you a little bit about the agenda overview. We're going to have this will be moderated by Jeff Sturman, the CIO of Memorial Healthcare System. We have been honored with the keynote speaker, Edward Marx, who's the Chief Digital Officer at HCI. And also he'll be joined after his keynote with panelist Sarah Richardson, the VP of IT Change Leadership of Optum, and also panelist Cheryl Rhodenfels. She's the Chief Technology Officer of America's Healthcare for Nutanix. So just a little bit of housekeeping. We prefer that your cameras are on. We try to make this as physical as possible or normal. If it was an actual seminar, we could see your shining faces. So don't be shy. Go ahead and turn on your cameras. Don't worry about it. We look forward to seeing you. Also, this session is recorded, so you will have the opportunity to review it again at a later date. And we'll let you know exactly when that recording will be available. As well, we encourage you to drop your LinkedIn profiles into the chat box. That allows people to know who you are, allows a little bit of networking that we can have in this type of virtual platform. So that's highly encouraged, as well as to use the chat box to ask any questions. Now, we do prefer you stay muted during the entire session, so we don't have any type of unwanted noise. But if you insist to ask your question live, just message us and we can turn on your mic. So with all that said, I'd like to bring up our current chapter president, Mr. Oscar Perez, who is the VP of IT at Memorial Healthcare System. So take it away, Oscar.
Thank you, Grant, and good afternoon, everyone. We have a great presentation for you all today. Like as Grant mentioned, my name is Oscar Perez. I'm the Vice President of IT at Memorial Healthcare System, and I'm also the President of South Florida HIMSS. You know, South Florida HIMSS, we've been very active this year, especially with the pandemic. We've been trying to bring as many good programs and as many good educational content to all of you, our members. And today is no different. We have an outstanding group of speakers today. That will be talking a little bit about digital transformation and digital front doors and many of the key things that many of our organizations are having to go through today. So we have a great presentation laid out for you guys today. Before we get started, I also would like to say thank you to our sponsors. Without our sponsors, we wouldn't be able to bring these educational content and presentations to you all really at no cost. And that's really always been our mission and our goal, is to bring you as much value as we can. And our great sponsors, Fortinet, KPMG, Nutanix, Dell, and Connections have been wonderful in being able to sponsor many of these events. So we want to thank them. We also want to make sure that you guys remain active in our chapter. This is a very big chapter for HIMSS. South Florida is a very active chapter. And there's a lot of ways that you all can get involved. If you look at the slide here, there's a link there that takes you to our website. We have many committees and many different ways that you all can get engaged and involved in the chapter. And again, this is a very active chapter. We try to bring as much educational content to you all and try to make it fun along the way. So please join us in many of these areas. I will say that as we're getting close to the end of the year, this is probably our second to last event. We have one more event coming up. It's the Wine with Friends. It's really a meet the board event. Very popular when you include alcohol in these events. But I think that's December 16th, if I'm not mistaken, Wednesday, December 16th. I believe the wine participation part of it is no longer active, but you're still able to join us and open up your own bottle at home. And it'll be a really exciting event. We plan to make it very festive. You get to meet a lot of the board members. And we'll make it very engaging, I promise. So please check us out for that. But anyways, without further ado, I'd like to introduce you to our moderator today. This is a person I know very well. He's a very innovative leader in our community and somebody that's become a really close friend of mine. Mr. Jeff Sturman is the Senior Vice President and CIO at Memorial Healthcare System. He was previously a partner with Cumberland Consulting Group, a national healthcare IT consultancy, as well as Ernst & Young. Jeff has over 25 years of healthcare experience, specifically in planning, management, and facilitation of digital transformation. So he makes a great moderator for today's event. He also has had quite a bit of impact in organizational change and in overall governance. He's an accomplished and results-driven executive with demonstrated success leading healthcare digital initiatives. And so without further ado, let's all please rise and welcome Jeff Sturman.
Oscar, thanks. And Oscar, you can get back to your real job now, so thank you for that. And good afternoon, everyone. It's great to be here, and I'm happy that we're able to do this. You're not going to have to listen to me an awful lot today, but you're going to have to listen to a lot of other really impressive people. So we're looking forward to that, and we're going to get right into that very quickly. Just by way of background, and Oscar, you did me a better justice than I could do, so I appreciate that. But I really do hope you're all doing well. I know it's been a really challenging, complex, interesting time for us all to live for the last 8 or more months through COVID and the pandemic. And unfortunately, we're still in this thing, and I know we're all looking forward to vaccinations and getting into 21. That certainly is looking more promising and a good year to come. So with that, before we get to our panel, and we'll get to introductions of our panel further a little bit later, I'm going to turn things over to Ed Marx. And Ed is a good friend of mine by background. We've known each other a long time. He'll do a much better job telling you his background and what he's done. As Grant kicked things off, mentioned that Ed is the Chief Digital Officer at Tech Mahindra Health and Life Sciences. He's got a terrific CIO background at a number of organizations. But without going through a lot of detail here, Ed, I'm going to turn things to you and give you the mic to introduce yourself and give us a case study here.
All right, thank you so much, Jeff and Grant and Oscar. I'm really excited to be with all of you today. I wish I was actually there in person in Florida. I'm actually out of Dallas, and it's like about 40 degrees freezing, and I'm just thinking it's probably a lot warmer down in southern Florida. But I am really excited not only to be with you today, but to really the panel with Jeff and Sarah and Cheryl. That's really going to be the best part of this whole program. So I'm going to get through my section pretty quickly, and I'm going to go through fast. I'm covering, it's only about 15 slides, but it's pretty, I think, robust, rich content that we could spend an hour on each slide. But the hope is just to give you some high-level ideas about digital transformation and the different things, that were on the agenda related to digital transformation in terms of what we would cover, and then really let the panel flush it out. Because again, from Jeff and Cheryl and Sarah, you're gonna get a lot more insights than you would just listening to me talk and going through slides. So it's really the best of both worlds, and I'm really jazzed about being your guest. So yeah, as Jeff mentioned, I'm Ed. I'm Chief Digital Officer for Tech Mahindra Health and Life Sciences. HCI is one of our subsidiaries, but really it's Tech Mahindra Health Life Sciences. I've been around for a while, and that's probably all you really need to know. I put in my LinkedIn there. So we're going to jump right into it. I call it Survival of the Digitalist. It's all about digital transformation in the future. It's based on this book. So we can hit the next slide. And these are the things that we're going to talk about. And let me move my chat box, my own chat box here, so I can see everything. It's really a quick definition of digital transformation. I won't read the slides. You can see it here, and then we'll end up with some research that might be of interest to you, and then jump right into the panel. So I'm looking at my watch, making sure that I leave plenty of time. So we can hit the digital transformation. What is it? I gave you the HIMSS definition. Is rather long. It's good though. I'm more of a simplistic person. I just say it's improved experiences powered by tech, enabled by design. My point here, and we talk about this in the book, is that it is whatever you and your organization decide. Just decide on a definition so everyone is together and run with it. There's no magic sauce. So when people ask me about digital transformation, is it new? I say no, it's actually, for me, let's see, my daughter is now, this was 1993, that photo you're looking at is, I can't do the math offhand, but I think she's definitely in her mid-20s. So that's when digital transformation first happened to me. Very traumatic birth of our firstborn daughter. She was born without life. She was then revived, had 3 life-threatening challenges. They wanted to life-flight her to a children's hospital a couple hours away. My wife was also hospitalized because of the trauma of the birth. We would have to separate our daughter. And then obviously we had another child at home, our firstborn son, and I had to work at some point. And so we're trying to figure out, wow, do we take the risk of the life flight, but then be separated from our daughter? What do we do? We were really young and unsure what to do. And then I realized, wait a second, the IT department has this amazing software. And this was in the early 90s where you could dial in. Remember modems for some of you? You could dial in to the system and you could see the electronic health record. And that thought occurred to me, and I was in marketing, but I was helping the IT department market this product to the medical staff. They only had about 5% adoption. And so they wanted some help. And so I helped them achieve 95% adoption. But anyways, I thought, what if we had one of our engineers drive down to Denver, Colorado, because this was in northern Colorado where this birth happened. And what if those neonatologists at Denver Children's dialed into the system, long distance charges and everything, and then consulted over the telephone in real time with our medical staff and took care of our child. And indeed, that's what we ended up doing. And our daughter's life was saved. And that's when digital transformation became real to me. So that next slide you'll see is my daughter at age 18. We went back to the hospital where it all happened, met one of the nurses, was actually the nurse that took care of her, had this emotional reunion. But that's when I realized my calling in life for my career was healthcare, technology. I knew it was healthcare. I was a janitor when I was 16 years old, working in a hospital. I knew I was supposed to be in healthcare. I didn't know what. So I sort of toiled around a little bit, but at that moment in time, it became clear the power of technology to transform people's lives became my life mission. And so that's what we're here to talk about. So digital transformation has been around a long time. We're just now using the buzzword. So that's the definition. That's sort of my background. And so on the next slide, we'll just continue to get into it. I said that we would cover a design for or template for digital transformation. Again, you can come up with any template that you want. This is just one example. So oftentimes the board members would ask me, what is digital transformation? I'd give them the definition I just shared with you, but it also helped to have everything on a slide. So we were big where I came from, where I served last as a chief information officer. We were really big on presenting everything on one slide. And so when they said, what is digital transformation? What's our template? What's our plan? This is the slide. It's not centered on technology. So that's one thing that I wanted to be really clear about. It's centered on the experience and it's about human-centered design. And then we had these different areas that you see. I think there's 10 or 11 of them that you could double click into, in a full presentation, not for the board, but for other members of our organization. And you could see more detail, but for the board, this is digital transformation right here, centered around the patient and clinician experience. So everything from culture that you see all the way to virtual care. So that's really the template. And again, because of time, we're gonna just plow right through, but I at least wanted to give that to you for food for thought. So on the next slide, we're gonna tackle the experience and the different personas. So it's really important that you understand who your audience is. And for every organization, this will be different. But again, my main point here is that just agree within your organization on who the personas are. So these are 7 common personas that I've seen. And so it's everywhere from the patients and providers. Those are pretty obvious. But what people don't think about sometimes are the caregivers. So that's like the family of the patient, or they don't think about their brand. Your brand is part of the experience. And then also other partners, like important strategic partners. So again, whatever it is for your organization, just identify them and have agreement. And that whole process of doing that will help you with developing your overall strategy. So on the next slide, we're gonna jump on a whole nother aspect, and that is, how do you develop a digital strategy? So you might be surprised to know that only about 30% of organizations have an IT strategy. And then when it came to digital strategy, my guess, I don't have a scientific number around this, but my guess is less than 5%. I think that's changed because of COVID, and a lot of people started developing them or are just now thinking, oh, now that we learned so much about COVID, we better have a codified strategy. So I'm going to give you 5 steps. You don't need a consultant to do these. I did all of these that you're about to see on the next slide. I did all of these myself by hiring a program manager is all I hired. Did this all in a very complex organization, very large global organization. I did this in 8 weeks. So it can be done at a very low expense, or there's nothing wrong with going and getting a consultant. So nothing against that approach. I'm just saying you don't have to. So again, sake of time, really fast, really high level, but you got to create a vision. You have to have a vision. For us, it was 50% of outpatient visits would be virtual, 25% of inpatient days would be at home, and we would do our first transcontinental open heart surgery. So that was the vision. Obviously with COVID, it's like, oh, big deal, 50%. But back then, 2-3 years ago, that was a pretty big deal. Even today in the COVID world, we're seeing everyone retreat quite a bit. So we went from a high watermark of maybe 80-85% virtual visits, and now even the best organizations are down to about 10 to 20%. So that 50% still pretty visionary, I think. Establish the right teams. Pretty obvious, but it's amazing people don't do it. And then lead, I believe in leading from behind. So you may have the vision and the passion and the energy to really drive digital transformation in your organization. Ideally, you've got a bunch of clinicians talking the talk and you're behind the scenes. Collect multiple inputs. So we did our own research. We did our own analysis. We talked to peer groups. We did so many different things to collect multiple inputs because we just don't know it ourselves. If it's limited to myself, I know it'd be pretty mediocre. So you have to go outside, and then outside of healthcare, that's the point here. Go outside of healthcare for digital transformation. And then organizational alignment and buy-in. Again, it's so obvious, but yet this is where most projects fail. So I think everyone probably knows how to do it, but you can do some extreme things. I would have office hours where I would walk. So we're a big organization, so people like to get their steps in. I would say, hey, you can sign up 6 a.m., let's go walk. And I did that. It was very convenient for the clinicians. I did after hours. We happen to have hotels connected to our healthcare system. I'm just giving you some ideas. And so they had places for drinks. And so I'd be like, okay, 6 to 7 p.m., we can meet at the lounge and we'll have a glass of wine and talk about things. So make yourself available, get that organizational alignment. I worked in the OR one shift a week, every Wednesday from 5 a.m. to 1 p.m. I worked in the OR. Again, part of the reason was just to get that interaction with everyone and get their buy-in. And then get resources for the duration. The worst thing is you got this great plan, everyone's excited, and you didn't really work with finance to make sure you had like a 10-year commitment. So 5 quick strategy steps, and we'll move to the next slide. Again, I know I'm going rapid fire, but again, the idea is just to throw some thoughts at you, and then the panel will unpack some of these and some other things as well. So how do you do all this? Robust governance is key. I think everyone knows that, although everyone struggles with it. The cross-functional buy-in I already talked about. Some bigger organizations can have a digital transformation office. I know it's not practical for everyone, but if you can. And then the final one, and I know we're going to unpack this a little bit as a panel, is how do you reduce cost and then have half of that reduction plowed back into digital transformation. So that's one way of self-financing, which I'm a big believer in and have done it a couple of different times, because people always say, well, we have no money to do digital transformation. Well, if you digitally transform IT, you will have money to digitally transform the organization. I know that's heresy for some, but I really believe that to be true. All right, so next slide. We'll talk a little bit about experience and design. Again, I'm not gonna do a justice to explaining this really, really well, just again, for the sake of time. But again, I just throw this out you as a challenge to really think about customer experience the way Madison Avenue thinks about it. Because if we just look to our peers in healthcare, as much as I love them, we're really going to be stifled. You really have to go outside of healthcare. So bring all that passion that you have for healthcare and saving people's lives and improving the quality of their lives, and take that, combine it with what other people are doing in other industries, and man, then you'll have digital transformation. So a very common way marketing and advertising look at things is really, what is customer experience? It's about the brand, it's about behavior, and it's about a book of record. I'm going to have one slide to sort of explain that, but leave the rest of you, if this sounds interesting, go do some research and find out more about it. So on the next slide explains a little bit more about that formula, and gives you some examples of what those things are. The record, behavior, and data vault to improve brand experiences. That's sort of the book of record. Behavioral experience is really about driving an experience through multiple channels, not just your digital front door, but multiple methods of doing that, and the whole experience with your brand. This is the stuff that works in other industries. It works in healthcare as well. You're seeing the advent of many CDOs, including in South Florida, being hired from other industries like entertainment, like Disney. You're going to see that continue until we get this. All right, so the next slide, that was a little bit about user experience and customer experience. Experience is brand. You just bring all that together. That's what brings the experience. So again, this is sort of marketing advertising. If some of you have business degrees, you've seen some of this before, but experience is your brand, and it's important that you nail it appropriately. So on the next slide, we're about done. It's just some research recommendations. Here's Chime and HIMSS have models for digital maturity. I think HIMSS just came out with a sort of a self-scoring. So whatever you use, Gartner or Chime or HIMSS, figure out where you are. So that's the only point here. You don't have to use this. This is from the book. You don't have to use this model. Just use a model, because you want to figure out the gap. Where are you? Where do you want to go? What's the gap? All right, next slide. I think we're down to 2 slides just to give everyone a sense. You can't digitally transform. I say some provocative things. Hopefully they're provocative, make you think a little bit, challenge you. Another one is, you can't do digital transformation if you personally aren't digitally transformed, and certainly your IT organization. It's funny, the reason a lot of organizations struggle is you've got IT that still operates like 2 generations ago. So you really need to become agile. So that's what all modern companies are. They're agile. All the tech companies that you see out of Silicon Valley and Facebook and Spotify, and you name all the new companies, they're agile. And I'm not talking about development. I'm talking about the entire way that IT operates. All right. So I think the last slide is really ensuring strong foundations. It's just sort of a summary. Understand, you need to have a robust infrastructure. You need to digitally transform yourselves. And that's really what this talks about. So I think that's it. I'm not going to go into a final personal story. Yeah, so we're done. So you can stay right here. Yeah, you don't even need to, you can finish through the slides. We're finished. Digital transform. I can't even say it. I'm talking so fast. Digital transformation saves lives. That's why I'm so passionate about this, so thrilled to be with you in the panel today, because when we get this right, we save people's lives. It saved my own life. I didn't go into the story. It saved my life a year ago. I'm so glad I was a champion for digital transformation, because the exact things that I was champion for saved my own life. So with that, I'm turning it back over to Jeff and panel. Thank you.
Ed, thank you. I mean, wow, we got a lot to unpack, I think, there. So thank you so much. We actually do want to hear your story. I think you can maybe share that through the panel conversation, and we'll get there, because I think your experience as a triathlon, as an author, as a CIO, as a chief digital officer, all very relevant to I think the stories we want to share with the group today. So thank you for that. And reiterating your authorship there, I think I saw in the chat, we put your link out there, and hopefully folks can learn a lot more from the books that you've published, which are certainly bestsellers. So thank you again. So before getting further into the panel, let's do some introductions, a little bit more robust introductions than what Grant and I did previously. And again, just to do justice here, I'm going to ask that Sarah, we start with you, Sarah Richardson, Vice President at Optum. Sarah, can you just provide a little bit of background and give a history on yourself there?
Sure, thanks, Jeff, and I'll keep it quick. Right now, I'm the Vice President of IT Change Leadership at Optum Care. So Optum has 180,000 plus people. We're part of United Health Group, and I am in a vertical that is one of many. So when everyone says, do you know so-and-so at Optum? I'm like, probably not, FYI. I live in the Optum Care space, specifically driving Optum Care technology and how we do primary and specialty care and the delivery of that, because I've been a healthcare CIO for several years and have worked in healthcare IT since 2000, so probably 20 plus years under my belt. I chose the role of change leadership specifically because after being a CIO for several years, I realized that while technology is a huge component of what we do and enables us to truly transform and deliver healthcare differently, the people side of what it takes to do that is a piece that often gets missed within the technology aspect. And so taking all of my technology background and not getting rid of it by any means, but now really focusing on the processes behind what we need to be able to do to deliver all of these transformations. That's really what I get to do today. So it's a pretty exciting space, and thank you for having me here today. And a plug for Ed. Ed's been a friend and mentor for years. You always want to hear his stories, because the reason I was able to do something like go, I'm not going to be a CIO anymore and create my own role in my company that's super high risk is because that's where my passion is. And he says, so why don't you go do that? And so thank you, Ed, because that's exactly what we did.
Thank you, Sarah. And of course, thank you, Ed. And we'll get right into our panel in a moment. Let me introduce Cheryl Rhodenfels. And Cheryl, I'll ask you to do the same thing, give a little background. I love the background that we all know where you work, maybe based on that background, but I'll let you do yourself justice.
Sure, Cheryl Rhodenfels. I'm the CTO for healthcare for Nutanix. I am a recovering CIO and CTO for healthcare. Ran a large system out of Chicago, Presence Health, and previously with Scripps in San Diego and Methodist of Dallas. One of the reasons I went to a technology company, as Ed mentioned, the agility of being able to move quickly. I was actually a customer, and I was able to take a healthcare system that had been failing and looking at the priorities and strategies and modernizing the organization, not just the technology, but the way we did business. And I think that's where my passion for digital transformation comes, is seeing how the patients can actually benefit. Technology is an enabler. I enjoy being with everybody on this panel, but let me tell you, Ed, I feel like I'm speed dating you on digital transformation. You went so fast. There was so much information. It was fantastic. And truly, your book has all of this in detail, and I recommend to everybody take a look through it. There's plenty to learn.
Thank you, Cheryl. So let's get right into the panel. And you know, Grant told me I have some creative license here with questions, and I know our panel all got some questions in advance. But are we sure we want to talk about digital transformation, or do we want to talk about I don't know, making old fashions, or you know, what you watched on Netflix lately? I don't know, Ed, what do you think? Should we talk digital transformation more?
Yeah, let's do. I'll take transformation for 300.
All right, so we'll do digital transformation for the next 20 to 30 minutes. So again, thank you everyone for sitting through this, and hopefully you'll learn something. And we've got 65 people online, so a good number of folks. Ed, you did a great job with really defining digital transformation for the group. But I think the reality is we all define it a little bit differently. And there's so many definitions out there. Whether you call digital transformation the same thing as IT today, whether you call digital transformation the consumer experience, I'd love to just learn a little bit more, maybe, and starting with Cheryl, if you don't mind, talking a little bit about what you define digital transformation as.
You know, one of the things we got to thinking about while preparing for this are the things, especially like through clinical workflows and patient experience, and I think Ed brought that up pretty well. Look at how consumers are driving the care that they need. They have every device at their hand and at their fingertips. And one of the challenges we have in healthcare is a lot of the behind the scenes technology and a lot of behind the scenes way that we do things are either mom and pop, they're analog, they're legacy. And if our patients and our consumers have better technology and better access than we have, they are demanding to be brought into modern ways of acquiring whatever services they need. And I think a lot of the digital transformation, we have to not only keep up with the customers and the patient demand, we actually have to go faster than it. And it's just, you know, a lot of hospitals just can't pivot on a dime like that. We've taken our times, we go a little slower to adopt newer ways of doing things. So I kind of see that we're being driven by the way that people want to be treated or want to experience care.
Yeah, for sure. And you know, we say so often that you know, hospital healthcare systems in general have always been an organization that patients come to. And I think that's changing through the environment that we're all living in that we need to be getting out to the patient where they want us to be taking care of them. And a lot of times that means we're taking care of them at their home as opposed to them coming to our hospital. So I'm sure we'll talk more about that. Sarah, any further perspective on definition of digital?
Yeah, what's interesting is the focus on the consumer is super important. And one of the questions I always ask people in our organization is, are you a consumer of our services? Do you receive healthcare from your own healthcare organization? And if the answer is no, and there's myriad reasons why, then be curious about what that experience is. So I constantly am a user of our tools as a patient, but then also thinking about how we pivot and think about how we can make that experience better across the board. So it's an ongoing family dinner conversation. So you had to go yesterday. What was it like? What did you like? What did you not like? And we just finished our open enrollment for benefits. So my inbox is flooded from our own team members talking about all the things they didn't love about it. And they won't answer the survey that gets sent out by our company, but they'll tell me. And then I'm supposed to go and like fix all the different components. But I love it because if you're literally, and people say eat their own dog food, which I think is horrible, you drink your own champagne in my world. So are you producing something you want to use? And that's part of that digital journey and that level of curiosity that comes in. So part of that definition is, are you a consumer of your own services? And if so, how are you contributing to how you continue to transform your own organization?
Yeah, that's great. And I certainly like drinking champagne more than dog food also. So I'm with you. Ed, any final thoughts on kind of the definition and how you round this out?
I think Sarah and Cheryl really summed it up well. And I think what you're hearing is a common word: experience. It's really about enhancing experiences.
Well, good. Thank you. You know, Sarah, I'm gonna start with you here in terms of the COVID and in terms of COVID and the pandemic. And obviously priorities have changed. And in the last 9 months, we've all done just, I think, what I'll call heroic things in IT to keep the movement going of taking care of our patients. I think, you know, a lot of publicity has been given to the organizations around our providers, and rightfully so, in making sure that they're taken care of. But I will tell you that I think IT and probably everyone on this call and well beyond this call have done also heroic things to make things happen. But in the face of COVID and digital transformation projects have taken root. But I would love to learn, what are some of those projects? What are some of the initiatives that you're hearing about, that you're partaking in, and maybe some of your clients even are moving forward on, where folks like you guys are helping them?
Sure. A couple of things to really think about in terms of the response to COVID from an IT perspective. Most of the things that IT enabled in a very rapid fashion were already on the IT books. It wasn't like IT suddenly did all of these things that hadn't been out there before. In fact, if anything else, when you did, and so Ed talked about maybe only 40 or 50% of organizations had an IT strategy. For those of us that did, being able to rapidly deploy all of the things that were in queue or all the things that we knew we needed to happen gave us an opportunity to do that. And so I would think about like our partnership with Nutanix as an example. When you find those huge cost efficiencies that allow you to redeploy and spend money in other areas, because all of a sudden the ideas that were expensive to overcome some of your previous technical debt are now being erased, you can then go after the things like everybody gets to work from home. Now we have these virtual care platforms that are more robust. Now the doctors are willing to do virtual care. And I think what's really also important to think about in that space is that when we talk about virtual care, that is not a telemedicine visit. I'm sorry, that's not how I think about virtual care. Virtual care is an ecosystem, and it really goes into like the exception-based care up front and how you're going to engage that patient long-term and using the right data and filters to drive it. So all these things that we've quickly deployed, that's fantastic, but it goes back to your back-end systems have to be prepared and ready to go. They have to stay clean. You have to keep making those investments. So if you have your infrastructure that's super sound, because that's what everything runs on, make sure all of your data sources are then clean, and all those data governance activities that people think are super unsexy and necessary, those need to happen too. When you have those two components aligned, you can add on all of the other components that allow you to truly transform and deploy these new digital solutions. It took something, unfortunately, for many organizations, as catastrophic as this pandemic, to realize that they had what they needed. They had to be willing to do something about it.
Yeah, so true. And you're right. So many organizations have foundation. We've been able to accelerate a lot of what we're all doing because we've had to. We've had to meet the demand. Ed, any further thoughts there on relative to new projects and things that have come out to face because of COVID?
Yeah, Sarah touched on a few of them, and it really is that whole new era of virtual care, and many progressive organizations, like where most of you or all of you come from, were already there or on the path. And so it was really just a matter of accelerating it. And I think the future is hospital at home. I think hospitals will become very much just acute care centers for the very sick, and that you'll be delivering most of the care where it's most comfortable for the patient, and that is at home. So we're seeing that happen now, and that trend is gonna continue. So it's kind of exciting, right? Because no one wants to go to a hospital, no matter how beautiful they might be in terms of the architecture, no one wants to be there. And so people would much rather convalesce at home. So I think we're gonna see that trend continue, and you know, the smart organizations like you all come from are prepared to move there.
Yeah, so certainly remote patient monitoring and the capability to extend all these care settings and create new access points. Really think of technology as a new way to deliver care, I think is absolutely appropriate. Cheryl, let me finish this thought and this question with you.
So a couple of things that Sarah touched on with data. I think analytics have been underestimated, you know, or really underaddressed in a lot of organizations. People are pivoting the focus. Not only they've had to add or pay more attention to the analytics, especially because the government is asking for cases. Now we're going to be tracking vaccines and things. So that agility of being able to add this kind of reporting and get it out quickly and seeing what meaningfulness it has, I think that's a project and a discipline that organizations are really working on right now, if they haven't. So it's jumped into the project list. It was a nice thing to have, but not everybody is good at it, but they have to focus on it. And I would say the second thing, unfortunately, we've had a renewed interest in information security. The bad guys are out there taking advantage of how fast we have to move and all the technology we're rolling out and all the changes. So I think those are the projects that are getting renewed interest, and they're also getting renewed funding because they have to.
Yeah, and you're so right. I'm so glad that you brought up security. The reality is it may not be sexy, but it's something that we all have to focus in on. And you're right, those sinister actors are out there. I know we're doing a large tabletop drill with our executive team next week so that our executives are really prepared to handle these ransomware type events. And I'm sure many of you have been exposed to that, and you all hear about it and read about it. One of the other things that you mentioned, Cheryl, data. And you know, we've all implemented EHRs for a long time now, not for the sake of an EHR, but really for the sake of the data, so that we can effectively and proactively take care of our patients and our consumers just better. And I'm really excited from a digital transformation standpoint, the idea that data can be extended from a consumer standpoint to them. And what I really mean by that is the idea that we have more data about our consumers than probably most other industries, and we just haven't leveraged it well. And so a couple examples, a patient comes to your hospital, no longer has to go through a arduous and tedious check-in and registration process. They have a smartphone. They can actually get a text that can check them in because we know they're there. These are kind of the consumer-centric models that I think are so exciting on the digital front, and so many more. You know, you can't go to a social media site today with them not knowing more about you and probably know what you're there for before you get there. We should know the same thing about our patients and help them take care of themselves and and be more of a wellness category as opposed to healthcare. So exciting times, I think, for all of us. Ed, I'm going to start with you on this one because I think you alluded to this in your conversation, and it's around funding and how we really prioritize the funding for digital projects, and how does that fit into all the other priorities that healthcare organizations have?
So Jeff, I just have to make a quick comment. For fun on social media, talking about data, I was talking about how in healthcare, no one knows me. And so I tagged a USAA, which some of you might know is a financial services type firm, and they're always rated #1 for customer service. And I tagged American Airlines, which I fly a lot. And I tagged, I'm not going to mention who I used to work for, but I tagged my old employer. And I said, who knows me? And immediately, and you can check this all out on Twitter, American Airlines responded something personal, USA responded something personal, and my old organization was crickets because they don't know and they don't share all that data. And it was just very interesting little fun experiment. So yeah, how do you self-fund? And I know that Cheryl has a lot of great ideas here and has done a lot of this type of work, but I think if you take a really honest look, now maybe there are a couple of you who've done this already and there's nothing else, there's no other juice to squeeze. But if you really look at digitally transforming IT within your organization, I think you're gonna find a lot of savings. You just gotta think differently than maybe you did in the past. And it doesn't have to be, and I focus on IT, but it could be in other areas like finance, like with robotic process automation and billing. That's a pretty low hanging fruit where you can take out a lot. But even if you look in IT, there's kind of some new emerging spaces like workstation as a service, things like that. And I'm not pushing any particular one. I'm just giving you a couple of easy examples. And and I've seen the analysis done. So I speak from experience, both theoretical and actual. You can pull out about 25% of the cost of IT. And then on the robotic process automation, a lot from finance, depending how big the billing department is. And so then the deal I always make with the CFO and the CEO is, look, whatever extra savings I come up with above and beyond the natural, typical type of reductions that you have to do, give me half to pour back into the organization in digital transformation. And everyone's been willing to make that deal. I say everyone, I did it twice. Been willing to make that deal, but I've helped others do the same thing. And so that's one way, is to self-fund. And it's all a matter of scale. It depends how big your organization is. For some, that might be $1 million, which is great. Some, it might be 100,000, which is great. Whatever you get. And then you prove yourself, you deliver, you execute, and you show, and people say, wow, that really worked. And then they're likely to give you more money and trust you in the future. But I know my colleagues have even better experience with that.
Thanks, Ed. So Cheryl, I know Ed just alluded to your experience here. Why don't you talk a little bit about self-financing and overall prioritization of digital projects?
Sure. So a couple of things, if we go through the prioritization and funding, especially, I spend a lot of time right now with FQHCs, some community health organizations, even places like Parkland here in Dallas. And, it seems that every cent counts, but the priorities have to align. We talked about business alignment, but they also have to look at risk and really and the return. But as you start to look at your riskiest environments or things that need to change, it's not just, do I replace it with the next thing, or is it just a life cycle change? But instead, it's if we do this as an organization, will it save us money other places? Because a lot of times, all the budgets and the priorities are not aligned. And I don't mean just with the business, but everybody has their specialties that they want to purchase, their projects they want to get through. But as a strategic thinker, especially CIOs in their organization, if you can orchestrate to see, oh, hey, this project over here can accomplish these 3 things over here, all of a sudden you free up funding or things that had been earmarked because you've taken a really a more high level approach to moving the project. It might take a little longer and you might have to get a lot of cooperation between the teams, But I think really addressing it that way and showing the value of how you can actually leapfrog into quicker, better, faster results, I think is fantastic. And I think the rest of it is like putting a puzzle piece together. All of a sudden, you know, if you've got monies released, it's figuring out, again, between those things, what are the riskiest, what are quick wins that are actually going to build that trust that Ed talked about, because you got to get the trust of the rest of the organization. And then really, it's always a balancing act of what can you do and when can you do it.
Yeah, thank you, Cheryl. Sarah, any thoughts and final comments relative to funding and self-financing?
Sure. The final piece I'd throw in there is that in all of your, so too often after a project or as you do a project, you really don't track those metrics and results after the fact. It's like we get to the 80th percentile or we even get to the end and we're like, oh, yay, we're done. And then we don't really think about the fact that IT enabled something the business needed. And that's one of my favorite things that Ed talks about. And it's really important is that IT enables these things to happen. The business is still the one who owns it. So in our organization, every IT leader over a product has a business partner. And that business partner is the one who is responsible for the long-term outcomes of what's happening with that product and if it's delivering as intended, because they're the ones who sponsored it. And so IT speaks business language. We don't talk about technology in terms of techno speak anymore. We have learned and taught our teams to speak in terms of how the business operates, so that as we create business cases, as we create the outcomes that achieve the intended results, do we need to keep or change this product over a period of time? Do we need to retire a product? Because app rationalization, if you've been in an organization for a long time or you inherit one, you spend an inordinate amount of time doing that. You have to speak the language of the business so that they appreciate how IT enables it, and then any of those savings or outcomes that you found gets reinvested back into the business. So you really, IT becomes almost a third person in your own conversation.
Thank you for that. I know Grant's going to give me the evil eye in about 5 minutes, so I'm going to ask that we have a couple more questions and get through these pretty rapidly. But I think certainly something on my mind, and I suspect on a lot of people's mind, will be what's the future of digital transformation relative to people? And so what's the people organization? What's the new staffing, the new resources, the new education that we all have to look into to help strengthen our own resources and our bench of people to be set up for success in this new world that we're faced with digital. So Sarah, I'm going to start with you relative to the people aspect of things.
Yeah, I'm glad you asked the question, Jeff, and I've got a couple perspectives on this. Number one is when you're in an organization, you think about ways you can modernize or digitize what's happening. Look at people on your team who have been doing the same job for 30 years or 25 years or 20 years. And if they've been doing the same thing for that long, there's a really good chance you need to modernize that space. That becomes a really difficult conversation because oftentimes those people aren't capable or have not been trained to do something different. So you really got to think about the human effect when you start to make big transformations, because it can have a headcount effect, not always when it makes people feel awesome, but necessary. So it's just a real conversation we don't have very often. The other piece that's really key, and it's what I focused on today, is change leadership. And that's the people side of change. You can have lean and you can have ITIL and all those fantastic things, but if you don't consider the people side of change and what that actually means, then you miss out on the strategy of people being not only aware and have a desire to do something, but knowledgeability and reinforcement to make it happen and to make it stick. And when you think about the PM, your project manager deploys the technology, your change managers, they deploy the process and they deploy the components that allow things to actually stick in your organization. Those things have to have an executive sponsor, and that executive sponsor has to come from the business or your physician populations. And so when you think about just popping technology in, that's only a piece of what really needs to happen. All of it hinges on humans, and that's what gets lost in translation all too often.
Yeah, couldn't agree more. Cheryl, the people side of things and the org structures of the future to support digital transformation.
Well, we've all seen the new job postings for the chief remote worker jobs that have been coming out. So that's the new title. So we're going to continue to see that. But I think the other thing that I work with a lot of teams that, again, some of our healthcare brethren are a little slow to adopt technology. So I work with a lot of teams, and they ask me to talk to their folks about how to move their jobs forward instead of doing maintenance and patching and things like that. That if they really want to get into the cloud technology, show them what's in it for them. And I think that's the big thing, is what is the future for you as you move through this digital transformation of your career? And they tend to love it because a lot of this technology and a lot of the training available is now online. They can do it at their own time. You don't have to send the whole crew out to some offsite location and so forth, but really showing what's in it for them, I think helps get that mindset going. Oh, when the technology retires, you're going to retire me. I think it's really important that shows that you have a place in this digital transformed environment.
Yeah, thank you for those perspectives. I'm going to wrap up with the formality of the panel with one last question, and it's a really simple one. Nothing simple in this world of digital transformation. And then we're going to leave a little bit of time, hopefully, for some questions from the audience and things I've seen come through chat. But if you guys were just to tell us, what's the greatest barrier to digital adoption? You know, not 10 or 20 different things, but maybe one or two things. What's the greatest barrier, Ed?
Ourselves, people. It's the hardest thing. It's not the tech. I think it's just our willingness change. Oh, it's all the things that Sarah is expert at, the whole change leadership. The tech is there. The financing, I think, is there to do the right things. But it comes down to people. That's the hardest part.
Thank you. Sarah?
People hate change. They absolutely do. So thank you, Ed. And yes, you've got to be able to create you have to have an awareness and a desire in your organization to want to do something differently.
Yep. And Cheryl?
I think it's the historians. We've always done it that way. It's quicker if we just do it the way we've always done it. And everybody hits that, and you can always hear, instead of why we should do something, the 20 reasons why it didn't work before.
Yes.
So I think overcoming that mindset, making it here's what we can do mindset, I think that's one of the biggest things to help.
You know, as IT professionals and digital transformation professionals, I think that's the common theme. I was on another group discussion earlier today. Same question was asked, same common themes were identified. You know, these initiatives, typically the technology is the easy part of this equation. The people and the process side of these equations are much more challenging. We talked about this very same question, and the answer by far was the care delivery process and capacity are the challenges. And I think that goes to operations, and it goes to people. So guys, thank you so much for the formal part of the panel. I know there's a few minutes left. Grant, I'm gonna hand things back to you and ask if you have the chat up, that we have a couple questions out there that maybe we can get our panel to react to.
Yes, thanks for that. We did have some questions that came in. Matter of fact, I think I asked one of them. And that is, do you believe that you have enough technology and digital literate executives to achieve your digital goals? Anybody want to answer that?
I'll start. I think that we do not, but it's up to us to help them, to help educate them, to help show them the possibilities.
Aha, yeah. Yep. It's got to be a teacher in that respect. And then to piggyback on that from Randolph Pelican, he states, do you see any pushback from process owners to a realignment to maximize the utilization of a digital model focused on the CX or customer experience? Is that solved or overcoming by impacting the internal user experience?
That was a really complicated question, Grant. You have to like simplify that for me to answer it. I'm sorry. I'm just like processing every word. I'm like, can someone say that in like a super simple way for me to answer it?
I think what comes down to is kind of what we already kind of said, overcoming the inertia of the status quo. And how do we push through, whether it's from the customer experience, the patient experience, or the internal user experience?
Yeah, I think the heart of the question and the solution is that if we blow the socks off of our internal customers, like we do digital transformation first from the inside out, they will catch the vision towards the customer experience. So sometimes it's hard. We talk about it like it's very natural for us because we're in it, but it isn't for the average executive, average person. So they're like, oh, they're talking about all this customer experience and, you know, the Starbucks experience or Amazon. And, but if they don't have that experience themselves internally, it's hard for them to think that you're going to do that for the customer. So I think it's a challenge to us to take everything we know, apply it internally, make changes, operate differently, like we've been talking about, make a digital transformation internally, builds that credibility, it builds the vision, builds the passion and the energy and the financials around doing something for the customer.
Interesting, very interesting. So we're coming down to the end. First, I want to thank everyone, Jeff, Ed, Cheryl, Sarah. This has been a fantastic webinar. We've got a lot of good information. People will be able to tune in to this through the recording that we'll send out, and they'll be able to play it over and over again. And I highly encourage you to take a look. I think we put it into the chat with Ed's book. So take a look at that, read through it. I think he's got some great ideas that you can begin to look at in your own system. And then finally, I'd like to bring up Kendo Brown. She is our president-elect, and to kind of tie off on everything that we're doing at HIMSS and what's next. So take it away, Kendo.
Grant, and thank you to all of the panelists and our South Florida HIMSS board. It takes a team of folks to put these things together, and our sponsors as well. Our next event was mentioned earlier on the opening portion of today's webinar. It's on December 16th. You can find details on the website and in the chat box. It's in the evening. Come meet the board. It will be fun. We're adding some holiday spin to it as well. If you don't have fun, I will personally give you back your $5 and mark your word on that. And I think it's too late to order the wine, but by all means, bring your own bottle. And if you're not a member of South Florida HIMSS, we have over 1,600 members in our South Florida HIMSS chapter. You can find out details on our website. And if you're an organizational affiliate, many are, like Memorial Healthcare, Jackson. Thank you for being an affiliate member. But if you want to become an affiliate member as a part of the provider market, please get in touch with any of us. And thank you for your time today. Thank you, panelists. We appreciate it, and happy holidays.
And with that said, we conclude our webinar for this week, and we look forward to seeing you in December, and happy holidays to you all. Thank you very much.
Yeah.
Thanks.